This is Life Talk with Ronak Koteja. Talk 100.3.
11:15. A very good morning. This is Ronak Koteja on Life Talk. Bright and upbeat because it's a Friday morning. और weekend जब होता है ना, तो the one thing that I always look forward to on the weekends, I don't know what you do, but what I look forward to is the afternoon siesta, because I feel that the afternoon sleep is so rewarding. It is so refreshing that it just trumps everything else. Like, even if I have to go to the most exciting event, but I have to give up my afternoon sleep in the weekend, I would rather actually do the sleep. And to talk about sleep and how important it is, and snoring and all that comes along with it, we have with us Dr. Ahmed Yasin Bahgat. He is a sleep surgeon with Saudi German Hospital. Dr. Ramadan Kareem.
Ramadan Kareem. Good morning.
Good morning. How are you doing? Did you sleep well?
Yes, of course. Yes.
You have to.
I have to.
You have to practice what you preach. All right, doctor, tell us a bit about yourself.
Yes, I'm assistant professor of ENT and sleep surgeon consultant at Saudi General Hospital, Dubai, and I am a fellow of European Board of Otolaryngology and a fellow of International Surgical Sleep Society, and I am fond of sleep and sleep apnea and snoring and how to treat them, how to diagnose them, so you can help a lot of people to sleep well and to, of course, for the social life as well.
Absolutely, we cannot stress enough on how important good sleep is. But what exactly is a sleep surgeon?
Yes, a sleep surgeon who performs surgeries to improve the quality of sleep, and it's I know it's a rare entity.
It's a very rare term.
Yes.
What kind of surgery can improve sleep?
In the past, we used to do just one surgery. Only one surgery that fits all people who snores and who cannot sleep is to cut part of the roof of the mouth. That's called the soft palate, to cut part of it and to widen the space. And actually, after many years of doing that kind of surgery, all ENT doctors know how to do that, but it showed that only 40% improved after that surgery, not all people. So we stopped doing all kinds of surgeries for sleep, and then many technologies and many updates came since 2010 and started to understand more what happens during sleep, why snoring happens, what the pathophysiology that's happening during sleep. So we started to introduce a lot of surgical interventions to make the airway better, to make the breathing better, and to allow for good sleep. That's the name sleep surgeon.
Talk 100.3.
Right, we're talking about sleep. Dr. Ahmed is with us. He's a sleep surgeon. You just heard it. 0586861003 is the number to WhatsApp if you want to join in the discussion. If you're facing any problems with your sleep patterns, very important. Now, doctor, the one of the things when it comes to sleeping is snoring. What exactly is snoring in scientific terms? And why does it happen? How does it happen? Tell us a little more about that.
Yes, that is very, very exciting also. Snoring is a sound, it's a bad sound that happens during sleep, only during sleep. It doesn't happen during wakefulness.
Exactly. And it only affects other people who are sleeping around you.
Of course, yes. It affects the sleeper and the bed partner also. And the snoring is a vibration. It's a loud vibration. It happens when air travels from the nose down to the lung, and it passes through a narrow passage. And when this air passes through a narrow passage, it makes that sound. And the more loud the sound, the louder the sound is, means the narrower is the airway at that point. We have actually three kinds of snoring. Not all snoring is bad. Not all snoring is normal. So in old cartoons, we used to see heroes when they sleep, they start to snore. That means that he is in deep sleep. Yes. No, that actually that means that there is a narrowing in the upper airway. So we have three kinds of snoring. We have the normal snoring, that if any one of us is tired, is deprived of sleep for a couple of nights, he starts to snore. And this is normal. We don't treat that kind. And we assure that people, they have nothing to do. But we have other two kinds of snoring. What's called habitual snoring. That means whenever I sleep, I snore. I sleep in the afternoon, I sleep in the night, I start to snore. And that means that there is something wrong happening in the upper airway. Or this narrowing that can lead to more narrowing, and up to complete blockage of the upper airway. And during that time, the sleeper doesn't breathe well. There is no air coming down to the lungs, and no breathing at that time for like 10 seconds, and this pause of breathing we call it sleep apnea. Sleep apnea means there is no breathing at that time, and this sleep apnea is usually followed by a rapid reinforced breathing cycle, and a loud snoring precedes that. So he stops for breathing and then and then rapid and very very loud
Yeah,
snoring.
we heard that. Yeah,
Yeah. So this kind of snoring, the last one, is a very serious one.
it's problematic.
Yes, it's problematic. It's problematic for the patient himself. He cannot go into deep sleep because he wakes up, and it's problematic for the bed partner because he is afraid of the surprises.
sounds, yeah.
Yes, that happen every night, and problematic also for the health because during that pause, during sleep apnea, there is no oxygen going into the lungs and into the blood. So there is a drop of oxygen during the night, and it is repeated for many times during the night, and that can cause many medical problems like hypertension, like diabetes mellitus, like strokes in the brain, and myocardial infarction, even thrombosis in the legs, and even there are some data says that it can lead to even sudden death during sleep.
But is it common or is it rare?
It's 2% among men and 4% among 2% among females and 4% among
Yeah,
males.
because I always thought men snore more.
Yes. We say that estrogen usually protects women against snoring, and it gives more tone to the muscles. And after menopause, the incidence is 1-to-1 after female to male ratio.
Okay.
So now we have 3 kinds of snoring. The first one we don't treat. The second one is a social problem. It's habitual snoring. It's just a sound, and we need to treat it with a minimal intervention. Yes. And the last one we need to understand well, and this is not treated like the old school, just to cut part of the throat to improve the breathing. No, it doesn't work like that.
So it's more non-invasive right now?
It's first we need to understand
why it's happening.
Why it's happening, yes. So usually those people, they are okay while they are awake because the muscle tone is very strong.
It's upright also,
yes, and when they change the position and they start to sleep, the effect of gravity start to make the loss of the tone of the muscle make the muscle collapse during that time, and then it's more narrowing. And so to treat just vibration is not like to treat complete obstruction.
Right. Great. So if you want to join in this discussion, if you're having any problems with your sleep, 0586861003 is the number. Dr. Ahmed is going to be with us for some more time.
Live Talk 100.3.
Vox Cinemas with Fun Asia Network, the official broadcasters of Tata IPL, are all set to give you a cinematic experience of cricket.
He advances, he goes in.
Immerse yourself in the magnum opus experience of the game at Vox Cinemas. Enjoy every moment in high resolution with Dolby sound that will make you feel like you're right in the stadium. Sit back in luxurious seating, indulge in delicious snacks and drinks. Book your tickets at voxcinemas.com or download the Vox app.
This is Live Talk with Ronak Koteja. Talk 100.3.
uptown girl or a small town girl or a boy, anyone can have this problem. We're talking about sleep problems.
Talk 100.3.
And we have with us Dr. Ahmed. He is a sleep surgeon from Saudi German Hospital. Now, doctor, we've established that, how important sleep is. And we're getting some questions as well. So Rishi is asking how to get quality sleep and how much sleep should be deep sleep.
That's a great question. So we start first, we don't start good quality sleep from the late night, but we start from the early morning. So if you sleep a lot during the daytime, you will not have a good quality sleep during the night. And it's better that if you have a sedentary life, you will not get into sleep during the night. But if you have a good exercise, you have a good work, you wake up early in the morning, and so you are exhausted during the daytime. So you will get into a deep sleep easier. And we advise also all people to take a shower before sleep, because when you take a warm shower, it increases the body temperature, and then when you go out, there is a drop of the body temperature. So this sudden change of the temperature usually facilitate the sleep. Of course, the bed should be comfortable, and the environment is good. The lighting is low light. Don't use the mobile phone while you are in sleep, or it's better to not watch TV while you are in sleep in the bed, because this will arouse you, will make you alert, will decrease the liability to go into a sleep.
But a lot of people keep the television on and then they go off to sleep. Even when I watch TV while in the night, I invariably tend to fall asleep.
Yeah, some people do that.
Even in the theaters, a lot of people sleep,
Yes,
the movie is a little boring.
Yes. So, some people, they are used to do that. Some people, when they listen to certain music, they
fall asleep.
Yeah, but
there are a lot of these videos on YouTube as well.
Yes,
sleep music.
Yes, of course,
You
meditation
recommend
music. Yes, I do recommend that. But I mean, if you do that and you cannot get into sleep, sometimes don't watch TV. It will help you.
We Indians believe. Yeah, sorry.
And also, if you are looking into the phone, it's better to switch on the night vision mode. Night mode. Yeah, it will decrease the blue light from the phone, and it will help you.
Yeah, there was a question for that as well, which I was going to take from Tia. She was asking, does the blue light of the mobile phone affect our sleep?
Of course, yes. That's why they did the night balance mode. So that I do recommend that if you are looking into the phone during the night and in the bed and with the low illumination and you want to get into sleep, it's better to switch off the blue light. And finally, some regular medicine that can help to improve the quality of sleep, like magnesium. Magnesium is one of the electrolytes in the body that when you're taking before sleep, it will help you to get into sleep. Okay. I don't recommend to take sleep aids like the
sleeping pills or something.
Sleeping pills, yes.
So they are generally only prescribed.
Yes, but it's because you will depend on them.
You can prescribe them, right?
Yes, of course. But if we can find that there is a main
problem. There is a reason.
Yes, okay. Like insomnia. Yeah. And even that, if people they don't, yes, like insomnia. Yeah. And even that, if people they have insomnia, they don't have good quality sleep, we don't recommend to depend on medicine. We have what's called CBT. It's cognitive behavioral therapy. It's to tell the patient how or the people how to get into sleep without pills. Usually we recommend people to go into bed at certain time. Yes, and when without phone, without television, without any electronic devices.
But the phone radiation, does it matter?
No, but I mean it will make the people alert.
Okay.
So I mean, if after half an hour you cannot get into sleep, get out of the bed. Don't stay in the bed more than half an hour, and then go to the living room or the reception area and start to do anything except dealing with electronic devices, like writing any thoughts, like painting, like drawing, anything with a pen.
Listening to music?
It's better no. Don't do
no electronics.
No electronics. Yes. Okay. And then after half an hour, go again into bed, and then do the same if you are not getting into sleep. But at a certain point of time, you have to get out of bed.
Can you go for a walk?
Yes, you can have a walk.
And then come back
and come back. Just half an hour. But for example, if you go to bed at midnight and you have to get out of bed at 7 a.m., if you fell asleep, if you fall asleep at 4 a.m., you have again to wake up at 7 a.m. Don't stay in bed until 10 or 11 a.m. No, you have to wake up at 7 a.m. So you will be very tired the next day. So you will get into deeper sleep easier the next days.
A lot of us, think that drinking milk before going to bed is good.
Yes, of course. Drinking all kinds of also herbs, all kinds of warm drinks.
Even coffee and tea?
No,
because they are.
No. Of course, yeah. No,
But with me, it doesn't matter. So many times I've had coffee before sleep. Like, not so many times, but many times I've seen.
Yes,
it doesn't impact at all.
It's the exceptions. Yeah, the main people when they drink coffee or even tea, they cannot sleep. But some people they drink coffee to sleep. So this is not.
But they do actually.
Yeah, but this is
I don't
exception.
drink to sleep, but then doesn't affect. I have good sleep. Inshallah, for now, I feel it will remain like that for the next few years, at least.
Yes,
but
all those advices for people who cannot get into deep sleep easily, who suffer to get into sleep.
Okay, go on.
And there is another thing that is very important. It's not related to all these kind of psychological or physical activities, but it's related again to our specialty, ENT. If you have a nasal blockage, and sometimes nasal blockage sometimes happen only during the night, because when you lie down and the gravity starts to shift the fluid to the head, so the nose become more congested. If it is like 80% blocked during the daytime and you don't feel that, you are okay with the 20%, this 80% will become 100%. And when you have a nasal blockage, you cannot get into deep sleep. So if we treat that, we will help you to.
I need to see you for sure then. Now, how do I suspect that I have sleep apnea?
That's a very good question. So you can ask you 8 questions. If
8 questions, huh?
Yes. If you get 5 out of 8, yes, you need to see a doctor, of course. We can collect these 8 questions.
You want to ask me now?
Yes.
Okay, go on.
So the 8 questions, we can collect them in a word called Stop Bang. It's a very common questionnaire. It's available on Google. You can write it STOP BANG. S stands for snoring. If you snore loudly during the night, every night, like habitual snoring, not night off and night on. This is first question. T stands for tired. If you wake up in the morning very tired and with the morning headache, so this is a second question. O stands for observed blockage of breathing, like as we said, like sleep apnea. If we see someone who is breathing well and then start to not to breathe, and then for a pause for 10 seconds and then takes a deep breath with a loud snoring, this is observed blockage of breathing, observed apnea. And P stands for high blood pressure. If you have a high blood pressure that is not controlled with 2 or more medicines, we have to suspect sleep apnea and very loud bad snoring. This is stop. Bang stands for BMI. BMI, that's the body mass index.
Yes.
If it is more than 30, it means obesity. A stands for age. If the age is more than 50, it's a risk factor because the muscles are weak. N stands for neck circumference. So if the size of the shirt is more than 17 for men and more than 16 for women, we consider it's high neck circumference. So you can check your shirt size. I mean in inches, 17 inch and 16 inch. And finally, G, the gender. Male gender is more liable to sleep apnea more than female.
Okay. Stop, bang.
Stop, bang. Yes. If you have 5 out of 8, yes, we need to do the further thing, that is sleep test.
Okay. All right. Finally, before we let you go, what are the treatment options that you have right now?
That's great. We have either medicines. We can treat some conditions with medications like allergy in the nose, like if you have a gastroesophageal reflux, like if you have inflammation of the upper airway with medicine, it can help in mild cases. More cases, we can do more minimal invasive procedure even at the clinic. We can inject some drugs in the throat that stop the vibration. That's for simple snoring. And more invasive procedure that we can widen the upper airway with some surgeries from inside to widen the airway and avoid the apnea and the snoring. And finally, we have That is very exciting. We have what's called surgery to stimulate the muscle, to increase the tone of the muscle. It's called hypoglossal nerve stimulation surgery. It's only available now in Saudi German hospital. It's a device that is implanted here, just below the tongue, and through a small incision in the neck. And this implant we leave inside. It gives more tone to the tongue, and it allows it from falling backward during the night.
Oh yes, okay. Is all of this covered under insurance?
All of them, yes, but the last one, it will be covered by insurance next July.
From next July?
Yes.
Okay, why like that?
It's very new. It's very new technology. It's not done in UAE.
They're sleeping over it for now.
Yes.
Thinking about it.
Yes.
All right, finally, one question has quickly popped in. This one's a sleepwalk. Do people really sleepwalk, and why does it happen?
Yeah, this is also a good question, because we don't have only snoring and sleep apnea, only the sleep diseases. We have another diseases that's called parasomnias. This is the name of the diseases.
Parasomnia.
Parasomnia, yeah. Including sleep talking. Some people are talking during
yes.
sleep. Yes, they keep talking
gibberish or anything like that.
Yes, and you don't understand what they are saying. And we have sleepwalking like that. And both can be either psychological due to a lot of stress, and you cannot get into deep sleep, and this is we treat them with medicine.
People who sleepwalk, they're actually in sleep, and they go about.
Yes.
They know their way around.
Yes, they know. They are not deep sleeper, of course, but they have a muscle tone in the body, and they can walk, and they can go around, but they are not aware what they did. They act their dreams.
But it can be quite dangerous, right? You might just end up anywhere.
They can go to they act their dreams. Maybe they dream that they are flying from the balcony.
Like that. Okay, that happens to us also. Like sometimes I feel that I get a lot of dreams.
Yeah,
there's another thing. Is dreaming good? Like, is it that?
Of course, yes. People who have sleep apnea, they don't dream.
So I have a lot of dreams. I dream every night.
That's good. Yeah. If you have nightmares, it's not good. But if you have dreams, it's good. Yeah. And also we have sleep paralysis. Some people, they feel like they want to move, and they cannot get out of the bed, and they are awake. And this is another term of
sleep. It's such a vast field, right?
Yes. And so either they are a psychological problem, or they have a problem in the airway, and we need to fix that to improve the oxygen. And then.
But the crux of it is that sleep is a very complex process.
Of course.
Ultimately, if you're not getting good sleep, it will impact every part of your life, including your social, psychological, physiological, all of it. You have to see a doctor like Dr. Ahmed for that. So, doctor, thank you so much for coming in today and telling us all about this good sleep patterns and everything else. So this weekend, back to Egypt?
Yes.
So I must tell you one thing about doctor. He told me that every weekend he goes to Egypt. He flies back to Egypt to his family.
Yes. And now I know how to sleep
in the
on board.
Flight.
Yes.
All right. You need to teach me that.
Yes, of course.
This is Talk 100.3. Talk Music. Brought to you by insurancemarket.ae.
Diamonds are forever. They are all I need to please me.